Hi, this is Dr. Paul Goldberg of the Goldberg Clinic. I'm going to be interviewing in just a moment here Mrs. Betty O'Banion, who's come into the clinic and was diagnosed with osteoarthritis. And we had as we had hoped for and expected, we had a very successful outcome with Mrs. O'Banion. And I wanted to just say a few words about this diagnosis. Generally, when we talk about arthritis, they are generally divided up into two major categories, and that would be rheumatoid arthritis and osteoarthritis. It has been my experience over the past 35 years of working with patients who have been diagnosed with various arthritic and autoimmune and other inflammatory conditions that these various diagnoses oftentimes are blurred if we look at what was really happening with the patient. A major principle that we have here at our clinic, based upon my own experience having had rheumatoid arthritis and diagnosed with rheumatoid arthritis as a young man, and having worked with patients over the years, is that every person is very different from the next, and that the diagnosis, the medical diagnosis the patient has received when they come into our clinic is not nearly as important as what we find out is individually happening with that person. A patient, you can have 20 or 30 patients walk in with rheumatoid arthritis, and it's been my experience that every single one of them will be different and needs a different approach to their problem. This is as opposed to standard medical care at a rheumatologist's office, where when a patient comes in with rheumatoid and is diagnosed with rheumatoid arthritis or osteoarthritis or whatever the arthritic name may be, is given a set of drugs that pretty much is just meant to address those particular symptoms, as opposed to what is actually happening biochemically, socially, psychologically, structurally with that patient. In Ms. O'Banion's case, diagnosed with osteoarthritis, the only options for her were to either have surgery or to have an ongoing succession of pain-killing drugs. And she had been on the drugs, and the drugs had proven, as they almost always are going to prove, to be of no use other than to dull the pain while continuing a rather miserable life as she was experiencing with all the discomfort and the handicapped nature that it left her in. Osteoarthritis is basically diagnosed as a so-called wear and tear arthritis, where the cartilage becomes thinner and thinner over time. It affects the larger joints of the body primarily, along with the smaller joints such as the hands and the feet. And if we look at a patient that has knees or hips that may have osteoarthritis, has that diagnosis, we generally see that the cartilage has worn thinner and thinner and thinner until the point, if the condition is allowed to progress long enough, where we actually have bone-on-bone contact. At that point, when you actually have bone-on-bone, although the general inflammatory level can oftentimes be helped significantly, surgery is often indicated. However, in the earlier stages, when these patients are in a lot of pain, they respond to many of the same things that a patient who may have been diagnosed with rheumatoid arthritis or lupus or whatever the name of the disease is will respond to. So in Ms. O'Banion's case, we didn't treat her osteoarthritis. We worked with the patient to get an understanding of why the pain was occurring, why her health was impaired, and then we helped her to provide the right conditions. And we come to this conclusion based upon physical exam, laboratory testing, and very importantly, doing a thorough case history. And based on those three things, we came up with an individualized plan to help improve her general health. And as her general health improved, the so-called osteoarthritis symptoms went away, her energy went way up, and her pains dissipated and eventually disappeared. So it's very important, I think, to mention that all people who are given these diagnoses don't think these are hopeless situations, that they have to resort to drugs. Certainly, the earlier we can get to a patient with these types of problems, the better off they are. But in all cases, we have to be careful not to be overwhelmed by these medical diagnoses, because people too often think of them almost like a death sentence. It's not necessarily so, as you'll see on this video and in many other videos that we present from the Goldberg Clinic. Thank you. Hi, this is Dr. Paul Goldberg of the Goldberg Clinic. Today what is the date today? It's July the 12th, I believe, of 2012, and we're here today with Miss Betty O'Banion. Betty's been coming to our clinic
I think since February.
Since February of this year. And we're here to talk to you a little bit about her case. She's been a delightful patient, has done very well. We're going to share her story with you today. Betty, what kind of problems originally brought you to the Goldberg Clinic?
Well, I was in so much pain about every joint in my body. I couldn't hardly walk, couldn't hardly move, get in and out of bed. Had to be helped lifted up, couldn't open my hands very well.
You actually had to be helped with by other people to get around with?
Just about.
And what was your grip strength like at the time?
I couldn't hardly open a bottle of water.
Couldn't open a bottle of water.
Fill the table.
Had you seen some medical physicians about the problem?
Yes, I did.
And what did your medical physicians tell you?
He had said I had osteoarthritis, and he gave me some pain medicine, which did not help. And then I went back to him again, and gave me some more that broke me out, and didn't help either, so.
So it didn't help with the pain, and it broke out your skin?
Yes.
It broke out your skin. Okay, how did you feel about how long a period of time were you in discomfort for?
Before I came to you?
Yeah.
I think since October.
Okay, so it started October, November, December. You've been in severe pain for about 6 months.
It's close to that.
Yeah, about 6 months. Okay.
4 to 6 months.
Mm-hmm. And so at that point, how were you feeling about your future?
I feel wonderful.
No, at the point when you first came,
over.
yeah.
I thought it was over for me. I thought I was going to have to be an invalid.
Yeah, I remember when you came in. You're a lovely person, and I know you try to be optimistic, and you have a lot of faith in God. But you were feeling somewhat down at the time, as I recall.
Very down, yes.
Yeah. What did you think were your chances of getting better when you came here? When you first came here?
I wasn't sure. I didn't know. It never was for me with this kind of doing.
And I know you have a very nice family, and your children were concerned about you. What did they feel about your situation at the time?
They was very concerned about me. They thought, that maybe I was not going to get well.
Uh-huh. Yeah.
They're
All right.
happy about it now.
They're happy about it now.
Yes, they can tell there's a lot of difference in the moment.
I'm always happy to hear that not only the patient's doing good, but the family's happy too. What has been your experience since you came here? As you said, it's been since February. What has been your experience at the clinic, and from the point where you started to the point where you're at today? Can you just tell us a little bit about what happened and how you have progressed or not progressed? Let's hear it from you.
Well, when I came, like I said, I was in a lot of pain and couldn't move. But every time I'd come, I felt better and better. So one time you asked me how was I doing, I said about 85% better. But now I think I'm doing about 100% better.
Now you're doing 100% better. So tell us specifically what kind of things have improved for you since you started coming here.
Well, I can get up and down by myself. I can open water. I can peel potatoes. I can do my housework now by myself, which I had the heart done before that.
All right, let me see your grip strength. Squeeze my hands up. Ow! I can't tell Betty. I sometimes ask patients to squeeze my hand as hard as they can, and with Betty, I have to be careful about that now.
Is it really hard? I mean, really?
Yes, you have the grip strength of either almost, I would say, of a strong man, certainly of a strong woman. What do you see as your future now compared to before?
I'm very happy about my future. I feel like now that I can go on and live a normal life.
Okay. Did I give you any drugs?
Not a one, thank God for that.
Are you on any drugs now?
No.
You are now drug-free.
Thank God.
Were you on drugs before?
Yes.
Yes, you were. Uh-huh.
But not now.
Okay. Now, osteoarthritis is supposed to be a permanent condition. People are not supposed to really get better from that. The alternatives are just painkillers, which you don't take,
No.
and surgery, which you haven't had.
No. Don't plan on it now.
Okay. What do you attribute to getting better?
Well, the knowledge that God's given us to eat right, treat our bodies right,
Right.
sleep,
So,
rest, which you
hello,
encourage
hello,
me.
Russell. This is Dr. Russell over here.
I thank God for you, doctor. I really do.
All right.
I
Thank you.
give God
Appreciate
the
that.
praise for it, for giving us knowledge to do these things.
And I appreciate that, Betty. And the knowledge that we have at our clinic really comes from unlearning a lot of misinformation that we're fed over the years, and really turning to nature, turning to ways that God intended us to live, and individualizing that for each patient so we address what's wrong with them.
Mm-hmm.
But we're really implementing what are natural laws given to us through God, applied to every patient. Well, Betty, I'm delighted at the progress you made. I think, as we were just talking about a few minutes ago, you got a good and a very long future ahead of you now. Thanks, Betty.
Oh, God knows. Thank you.